All right, welcome back, Focus Learners. Today, we're stepping right into the shoes of a medical detective. We're going to decode the disguised, overlapping, and sometimes literally life-threatening diseases of the rainy season. This explainer is all about cutting through the confusion of monsoon illnesses using hard data, clinical studies, and clear visual evidence.
Okay, let's dive into this. Here's our roadmap for today. We'll start with the overarching monsoon threat, compare dengue with the flu, uncover the leptospirosis disguise, reveal a massive diagnostic breakthrough, explore some pretty surprising respiratory clues, and then wrap it all up with prevention and protection.
Section 1. The Monsoon Threat, Setting the Scene. You know, there's something undeniably atmospheric about the rainy season, right? But beneath those refreshing showers lies a rapidly shifting biological landscape. I want you to think like a diagnostician for a second. Why can a simple rainy day or just a slight drop in temperature turn into a high-stakes medical mystery? Why do emergency rooms suddenly get flooded with patients who all look like they have the exact same illness? Well, based on data from MedPark Hospital, the monsoon essentially creates a perfect storm. We see cooler temperatures and higher humidity combining with flooding from heavy precipitation. And this environment, it is an absolute paradise for pathogens. It allows them to survive longer and spread much faster, whether that's through the air we share in crowded indoor spaces, contaminated floodwaters, or animal vectors like mosquitoes whose breeding grounds literally just multiplied overnight. Add in the fact that sudden weather changes can actually weaken human immunity by stressing our bodies, and you've got the ideal conditions for a major, rapidly moving outbreak.
Section 2. Dengue versus the flu, the master of disguise. So this is where our first suspect enters the scene, dengue fever. The problem, it's an absolute master of disguise. Gleneagles Hospital gives us some great baseline rules to spot dengue when it's hiding behind flu-like symptoms. Now, influenza-like illnesses usually have a respiratory focus. Think coughs, sore throats, nasal congestion. You feel it in your chest and throat. But dengue presents quite differently when you actually look closely. The onset is sudden and aggressive. We're talking a spiking fever of 40 degrees Celsius, that's 104 degrees Fahrenheit, accompanied by severe headaches, a really distinctive pain behind the eyes, and intense joint or muscle aches. It's that deep, debilitating bone pain that often earns dengue the nickname breakbone fever.
But the stakes escalate rapidly here. If you're tracking symptoms, these 4 warning signs demand immediate attention at the A&E. Severe dengue can cause your blood vessels to actually leak plasma. This manifests as bleeding from the mouth, gums, or nose, internal bleeding, which can lead to black vomit or stool, clammy skin with a weak pulse, which indicates the body's going into shock, and severe abdominal pain. Recognizing these escalating steps, actually knowing the difference between a bad ache and a full-blown internal emergency can quite literally save a life. Section 3. The Leptospirosis Disguise, a Deadly Confusion. Just when doctors think they know exactly what they're looking for, a second major suspect arrives on the scene, and it perfectly mimics our first, leptospirosis. It's a severe bacterial infection spread through water contaminated by animal urine, which is a huge risk during monsoon floods. During its early stages, it looks exactly like dengue. But according to a Critical Plus One study, this confusion is deadly. See, dengue is a viral infection. You manage the symptoms and support the body. Leptospirosis, on the other hand, is a bacterial infection. It absolutely requires targeted antibiotics. Misdiagnosing leptospirosis as dengue leads to delayed antibiotic treatment, and that delay directly increases the mortality rate. Emergency doctors urgently need a rapid way to tell these two apart before it's just too late. Now, what's really interesting here is the sheer scale of the detective work. In this study from Reunion Island, which is an area heavily hit by these overlapping epidemics, researchers painstakingly isolated 98 confirmed leptospirosis cases and compared them against 673 confirmed dengue cases. By analyzing the initial blood work of these patients the exact moment they arrived at the hospital, the researchers were hunting for a single, reliable differentiator amidst a sea of identical symptoms.
Section 4. The CRP breakthrough, cracking the case.
After sifting through dozens of clinical and biological factors, the researchers finally found their smoking gun, 50 milligrams per liter. This is the threshold for C-reactive protein, or CRP, which is a key marker of inflammation in the blood. The study revealed that a CRP value greater than 50 safely and effectively isolates leptospirosis from dengue fever. The data showed that dengue patients typically had very low CRP levels, averaging around 18. Leptospirosis patients, they had sky-high levels, averaging over 220. And the proof is absolutely in the data.
This ROC curve from the study demonstrates the high diagnostic accuracy of using just this marker alone. At that 50 milligrams per liter cutoff, it has a massive 94% sensitivity and 93.5% specificity. In simple terms, it almost never misses a case of leptospirosis, and it rarely raises a false alarm. This is a real game changer because it means emergency doctors don't have to wait days for complex lab cultures to come back. They can use a simple, rapid CRP test right at the point of care to confidently start life-saving antibiotics for leptospirosis. Case closed, right? Well, actually, scratch that, not quite. Section 5. The respiratory clues, the plot twist. Every good mystery has a plot twist, and to find ours, we look to a Journal of Infection in Developing Countries study from the Andaman Islands. Researchers analyzed blood samples from nearly 15,000 dengue suspects. The demographic data clearly highlights a higher dengue positivity rate in urban males aged between 16 and 30. But, it wasn't just the demographics that surprised the researchers. It was the specific symptoms these confirmed patients were presenting with in the clinic. So the crucial point here is this incredible finding. Rhinorrhea, which is a runny nose, and other respiratory symptoms showed a significant association with dengue infection. Remember earlier when we established that baseline rule, the one that said respiratory symptoms mean flu and non-respiratory symptoms mean dengue? Well, this massive study proves that viruses don't always read the textbooks. In certain outbreaks, respiratory discomfort can actually be a significant clue for dengue, reminding us that medical science must constantly adapt to the data on the ground. Sometimes those hard and fast diagnostic rules are meant to be broken. Section 6. Prevention and Protection. Empowering the public. Okay, we've solved the diagnostic mysteries, but the best medicine is always preventing the illness from taking hold in the first place, right? Let's move to how you can build a protective shield around yourself based on Gleneagles Hospital guidelines. Because the delivery methods of these diseases are entirely different, the prevention tactics have to be different too. For the airborne flu, your focus is an annual vaccine, wearing masks in crowded areas, diligent hand washing, and social distancing. But for the mosquito-borne dengue, your focus completely shifts to the environment. It's about clearing out any stagnant water where mosquitoes breed, using citronella or DEET repellents, wearing long sleeves when you're outside, and installing window screens to keep vectors out of your home.
Which brings us to our final thought. Armed with these clues, the high stakes of overlapping symptoms, that life-saving 50 milligrams per liter CRP threshold, the surprising respiratory plot twists, and targeted prevention tactics, how are you going to view a simple fever during the next rainy season? You are no longer just a passive observer of the monsoon. You're an informed, focused learner equipped to navigate it. Thank you so much for joining me on this explainer. Stay safe, and as always,
thanks for watching. Please like, comment, share, and subscribe to motivate us.